Okay, well, we'll go ahead and get started here today. Welcome. This is Understanding Asthma, brought to you by the OSU Health Plan and Your Plan for Health. My name is Allison Barney. I'm one of the health coaches here with the OSU Health Plan. I'm excited to present this here to you today. I spent a number of years prior to coming to the health plan and doing health coaching, working with lung patients through pulmonary rehab. So just wanted to share today a little bit of information here to help you better understand asthma and maybe learn some tips and strategies to controlling your lung disease here. So these are the objectives for today. We're just going to first kind of review a little bit about the condition, and then we'll talk about different types of asthma. We'll go through some different triggers that might trigger signs and symptoms of asthma, and then talk a little bit about some management strategies. We'll discuss some healthy lifestyle changes that you might want to consider making, and then also some breathing exercises that can help in controlling your asthma. And then we'll wrap up here with reviewing the importance of an asthma action plan. And then also I'll provide you with just a little bit of additional resources for support. So, asthma is a condition in which your airways narrow and swell and may produce some extra mucus. So, this can make breathing difficult and trigger coughing, a whistling sound, or wheezing when you breathe out, and shortness of breath. During an asthma attack, the sides of the airways in your lungs swell and the airways shrink. Less air is going to get in and out of your lungs, and mucus that your body makes clogs up the airways. Asthma can't be cured, but its symptoms can be controlled. Because asthma often changes over time, it's important that you work with your doctor to track your signs and symptoms and then adjust your treatment as needed, depending on how your condition progresses here. So, asthma signs and symptoms include shortness of breath, some chest tightness or pain, maybe wheezing when exhaling. And that's actually one of the most common signs of asthma in children. Um, you might also have trouble sleeping caused by some shortness of breath at night, coughing or wheezing. And then coughing or wheezing attacks that are worsened by a respiratory virus, such as a cold or the flu. Signs that your asthma is probably worsening could include that you're getting these signs and symptoms more frequently or they're more bothersome. Maybe you're having increasing difficulty breathing. Um, and it might be measured by a device to check how well your lungs are working, called a peak flow meter. So your doctor might do some different breathing exercises to check, how your breathing is, and if things are improving or getting worse. And then also, if you need to use your quick relief inhaler more often, that also can be a sign that things might be progressing or getting worse with your asthma. So, when you're diagnosed with asthma, your doctor will evaluate the severity of your condition. Um, and for some people, symptoms only show up occasionally in response to maybe specific triggers. But for other people with asthma, their symptoms might be much more present more often. It's something that they kind of encounter or deal with on a day to day basis. Beyond the differences in severity, there are also a variety of types of asthma with differing symptoms and triggers that can lead to discomfort, even though asthma is kind of considered a single condition. Knowing what triggers your asthma is important in helping you identify which type you have so you can get proper treatment for your asthma. Also, several types of asthma might overlap, meaning two or more of these categories, kind of detailed here, might apply to your condition. So the first one is adult onset. And really, this type of asthma is just someone that is older than 20 years old and is diagnosed with asthma is considered adult onset. This happens sometimes because people might have asthma earlier in their life, but they haven't shown any signs or symptoms of having asthma until they're adults. Sometimes it's due to people like managing to avoid their triggers. For example, some triggers for folks are household cleaning products and disinfectants. And often, as children, right, we're not using those types of products, and doing a lot of cleaning in most cases here. So, for much of folks' lives, they may have been able to kind of avoid that particular trigger for their asthma. The other way those symptoms could kind of surface as an adult, right, is a viral infection, kind of unmasking some of their symptoms. Nocturnal asthma or nighttime asthma involves the same symptoms as other types of asthma, but they're exacerbated or increased during the evening hours. So when you're sleeping, having more of those symptoms, or more frequent symptoms, or even as you're preparing to like lay down and go to bed for the evening. Allergen-induced asthma is the most common, and it affects about 25 million people in the US. And it occurs because the immune system identifies the allergen as a threat, and in turn, the body responds by releasing antibodies that causes the inflammation in the lungs. Non-allergic asthma is really any form of asthma that is not triggered by allergies, and it is considered non-allergic. Um, while most of the symptoms of non allergic asthma are more or less identical to those of allergic asthma, the triggers are typically different. Occupational asthma is triggered by an irritant you might be exposed to at work. There are some professions that are more prone to being exposed to irritants that can be triggering. EIB, or exercise induced bronchoconstriction, um, is asthma that is triggered by exercise. So the name's changed a little bit. You may have heard it being referred to before as exercise induced asthma. But it's important to note that the exercise is the trigger and not the cause of the asthma. So they did change that name a little bit, but actually, up to 90% of people with asthma will experience airflow obstructions and some breathing symptoms while exercising. And then finally, the last kind of type there is the cough variant asthma, or CVA. And this type of asthma just presents as a chronic cough. So, an asthma attack can happen when you're exposed to asthma triggers. Your asthma triggers can be very different from someone else's triggers, and knowing what yours are can help you learn how to avoid them. So, watch out for attack when you can avoid your trigger. Some of the most common things are things like tobacco smoke, dust mites, outdoor air pollution, pests, as such as like cockroaches and mice, um, pets, our dogs, our cats, right? Could be triggers for folks. And then things like mold, smoke in the environment, like outdoor smoke from things like burning wood or grass outdoors. And then infections like cold or flu. Some other asthma triggers might include things like exercise, pollen, or certain kinds of weather conditions. And then also, as we talked about here, cleaning or disinfecting products. So I have a couple of links up here on the slide that also can be helpful in understanding a little bit more about your potential triggers. So if you want to learn how to maybe reduce some different allergens in your home, if those could be triggers for you, there's a great link up there about how to kind of prepare your home to be more asthma friendly and reduce those triggers in your house. Um, if weather conditions, pollen, right, increased pollen seems to be a trigger for you, it's always helpful to check kind of the air quality forecast before you plan to be outside for extended periods of time, or if you're going to be active or exercising outside, you may want to know ahead of time what that air quality is like and if it's going to be a trigger for you. And then if cleaning products and disinfectants seem to be triggers, the EAP has a great website linked here about how to pick some safer choices for household cleaners and chemicals and things that you might be using in and around your home, but that are less irritant to folks with lung conditions. So the good news is, right, we can't control asthma, but, or can't cure asthma, but we can control asthma, right? And we can avoid, having attack. And some of this is number one, getting in a great routine. Checkup here with your physician or your pulmonologist or your allergist, just receiving routine medical care with your asthma. Um, the other thing you can do is kind of create this asthma action plan with your doctor. And this is just to have that conversation or have you both be on the same page so that you know what to do or what you can do if your asthma or your symptoms get worse. So we'll talk about in a couple of slides here what an asthma action plan might look like and also give you a resource. But it could just be as simple as keeping like a diary or notes to track how well your plan is working, or to track triggers, things that maybe make your asthma symptoms worse. Or on the flip side, maybe things are getting better here, right? You've started a new medication. So tracking some notes and things like that is a great way for you to work with your doctor to make sure that you guys are on the same page and you've got this good asthma action plan. You'll definitely want to take your medications as prescribed by your physician here or your medical professional. And then also, if you know your triggers, right, you can learn how to avoid them or hopefully potentially modify them. And then you also want to get your flu shot and other vaccinations so that it can help prevent you from getting viruses that could make your asthma condition worse. Your doctor might also recommend one or more of like the following healthy lifestyle changes to keep your asthma symptoms in check as well. So aiming for a healthy weight, being obese or obesity can make asthma harder to manage. So definitely talk to your doctor about ways that you can keep or maintain or get to a healthy weight. Even a 5 to 10% weight loss can really help improve asthma symptoms. Um, Having a healthy diet, eating a lot more fruits and vegetables, getting enough vitamin D can provide important health benefits as well. And then regular physical activity. Even though we kind of talked about exercise could be an asthma trigger for some people, we definitely don't want to try to avoid it. Physical activity is an important part of a healthy lifestyle, and then certainly can help in some of these other things like keeping a healthy weight, managing stress. So we don't want to cut it out, but maybe talk with your doctor about, what level of physical activity is right for you, or you can ask about medications that can help you stay active. You might even, talk about that in your asthma action plan if you want to be physically active. There might be programs too to help you exercise safely and also learn more about your asthma, such as pulmonary rehab. It might be something that you qualify for. So have that kind of discussion with your doctor. Um, Managing stress can be a helpful thing too. Learning different breathing and relaxing or relaxation techniques can help with symptoms. So, if you need even additional support, meeting with a mental health professional, if you have things like anxiety, depression, or panic attacks, can really kind of help. Help you manage those emotional triggers, right? That could make your asthma symptoms worse. And then, if you are smoking, you definitely want to quit smoking. And then also try to avoid secondhand smoke. So, smoking tobacco, inhaling smoke from somebody else can definitely make asthma a lot harder to treat. But also, it's worth noting that vaping and e cigarettes or being exposed to that type of vapor can also be linked to asthma symptoms. So, research is definitely suggesting that nicotine and then flavorings that are found in those vaping e cigarettes can be really damaging or harmful to our lungs as well. So, not only cigarette smoke, but definitely e cigarettes, vaping, that kind of stuff too can really be um, challenging to managing your asthma. And then last but not least, getting a good night's sleep or quality sleep. So, certainly getting quality sleep can be really difficult sometimes for people with asthma, but maybe making some changes around healthy sleep habits by like going to bed or going to sleep and getting up at regular times, following kind of maybe a calming bedtime routine that you set for yourself, and keeping your bedroom or your sleep space nice and cool and dark. Where again, managing some of those potential allergen triggers in your sleep environment could help as well. Keeping clean linens and drapes in your room, things that aren't going to kind of um, collect or produce a lot of dust. And then I did want to touch a little bit more here on exercise and asthma. Um, so EIB, as we talked about, one of the types of asthma here is caused by kind of the loss of heat, water, or both from the airways during exercise when we're quickly breathing in air that is drier than what's already in our body. So symptoms typically kind of appear with EIB within a few minutes after we start exercising, and they may continue for 10 to 15 minutes even after we finish an exercise session or a workout. So, certainly anyone can kind of experience some of these symptoms, especially if we're out of shape or we haven't exercised for quite some time. We might be more winded, right, or short of breath. But with EIB, these symptoms are definitely much more severe. Um, EIB triggers could include some airborne irritants that might be related as well to specific sports or activities. So, some examples of that could be chlorine with swimming. That could be a trigger. Maybe air pollution while you're out running or cycling. Cold, dry air while doing some um, activities such as like ice skating or playing hockey, things like that, in those types of environments. And then air temperature during some things like hot yoga, that's usually contraindicated there for people with asthma and lung conditions, with those really like hot, um, usually humid environments with hot yoga. Um, it was thought for many years that breathing in cold air makes EIB worse. But much more recent studies indicate that it's more the dryness of the air rather than the temperature. And that's usually more of the trigger. So cold air, though typically contains less moisture than warm air, and quickly breathing dry air dehydrates those bronchial tubes, so it causes them to narrow and constrict. So you might notice it more in cold temperatures because that air does just tend to be drier, right? Less humid. And then certain sports and activities might cause more symptoms with EIB. And these are the ones that tend to require constant activity or again are done maybe in cold weather. So think about like soccer or basketball or long distance running. Those could be that constant activity that just kind of exacerbates more symptoms of EIB. Or things again done in the cold, like skating or skiing, especially things like cross country skiing could be an activity where you see or feel more symptoms. The activities that are maybe least likely to cause EIB symptoms could be things like walking, hiking, or recreational biking, sports that require maybe just short bursts of activity, things like volleyball or baseball, golf, football, shorter distance running, like track and field sports. Um, and research has kind of shown too that it's important to know that exercise really has been found that to reduce asthma symptoms. So again, we don't really want to avoid it, but we want to know how to manage it with exercise. So it is beneficial to perform aerobic exercise and then also strength-based exercise that can help strengthen the muscles that help in our respiration, our accessory muscles. So definitely have that discussion with your doctor if you find that asthma is kind of keeping you from being active, or you're concerned about that, or you want to know how to be active more safely. Some things you might want to try, in addition to talking with your doctor, would definitely be make sure to warm up before exercise. Doing some gentle movement or gentle exercises for about 10 to 15 minutes before you start more intense physical activity can be very helpful in managing your symptoms. And then you also might want to consider covering your mouth and your nose with a scarf or a face mask, especially when you're exercising in cold, dry weather. Um, Try to breathe through your nose if you can while you exercise. This actually helps warm the air more that goes into your lungs, and can help manage those symptoms. And then you might want to think about having to change kind of your exercise routine to avoid triggers. So, kind of knowing your limits, what's too much for you. At this point, or again, if you typically exercise outdoors and you notice that the air quality is poor, you may need to change how and where you're going to exercise to avoid those different triggers. Um, and research is also suggesting that interval training can help a little bit with preventing exercise induced asthma or EIB. So, interval training really that's just doing high energy exercise that's alternated with periods of rest. So, some highs and no lows there instead of constant steady state exercise for a long period of time. And then you might want to, see an allergist, talk with your doctor about, prescription medications that might be more effective than the over-the-counter treatments that you may be using. Or maybe you can pre-treat with something prior to exercise to help manage your symptoms and open up your airways a little bit more. So like aerobic exercise and its assistance here in improving heart function, strengthening our muscles. Doing some breathing exercises can help make our lungs more efficient as well. So, when you breathe in and out, your diaphragm is doing usually about 80% of the work to fill your lungs. So, breathing exercises in particular can help strengthen our diaphragm and then also train our body to breathe more deeply and more effectively. Um, these exercises can seem kind of simple and easy to do, and they are, but they take a little bit of time to master. So ideally, you want to kind of practice both of these types of exercises here about 5 to 10 minutes every day if you can. And you don't really want to try the first time to use these exercises when you're having an asthma attack or you're feeling short of breath. You really want to try them when you're breathing okay. So that way, you're more comfortable with the technique, and you can use them when you are symptomatic, when you are short of breath. So, kind of the more you practice now, they really can be not only a great way to strengthen your diaphragm, improve, your body's ability to breathe deeply and effectively, but be kind of that tool that you can use when you get in a situation and you're symptomatic with your asthma. So the first one up here is pursed lip breathing. And you can perform this exercise sitting or standing. And really, all you're doing here is you're inhaling through your nose, like you're smelling a flower, and blowing out through pursed lips, like you're blowing out a candle. The key to this, though, is as you practice, you want to try to make your breath out or your exhale about as twice as long as your inhale. The second exercise here is called belly breathing or also diaphragmatic breathing. And this is to train us to breathe with our diaphragm. So, what you're going to do here is you're going to lay on your back. You can use a pillow if you need to elevate your head, but you want to place one hand on your belly while the other one is on your chest. And when you exhale, through your nose, you should feel your stomach expand and your hand rise. And then with your exhale, through your lips, your belly should lower. So we're doing pursed lip breathing, but we're also making sure we're breathing with our belly or our diaphragm. So as we inhale and we fill the lungs, our diaphragm is lowering, making space for those full lungs. That's why our belly should go out. As you practice, the hand that's on your chest, you want to keep that feeling almost stationary. We don't want our chest to be rising. We want our belly to be rising. So that's kind of a good way to check and practice on that one. If you need a little more help here with seeing this or some explanation, I've got some great links here on the slide. These two links will show you videos on how to do these breathing exercises, as well as there's kind of a handout there, a link for a handout on the bottom that will walk you through these as well. So they're really good ones to kind of practice. And then finally, this is an example of an asthma action plan. So, creating this asthma action plan with your physician can help you develop a treatment plan and really feel comfortable with the steps to take if your asthma and symptoms are getting worse. So, as you can see on the slide, there are 3 zones with the action plan, and you'll develop with your physician steps to take for each one. So the green zone means kind of you're doing well. It means your symptoms are really managed, you're not having symptoms. You can kind of do these normal activities. So you and your physician will come up with a treatment plan based off of being in the green zone. The yellow zone means that your asthma is getting worse. That might mean that you're having more coughing, wheezing, chest tightness, or shortness of breath. Maybe you're waking up more at night due to your asthma, or some of your activities are maybe limited or more challenging. So you'll want to come up with a plan for that when you start to notice that. So that might be using different medications. Your doctor may want you to communicate with them, but again, knowing what to do when you start to notice those symptoms. And then the red zone kind of means we're in more of a medical alert situation. Could mean that you're very short of breath, these quick relief medicines or inhalers are not working. You can't do certain activities at all, or maybe you were in the yellow zone, but the symptoms are the same, or they're not getting better. They're actually getting worse within 24 hours. So again, you'll come up with an action plan for that. There's a link there I've included on this slide from the National Heart, Lung, and Blood Institute for Asthma Action Plan PDF. So it could be something that you use or talk to your doctor about, but it also could be just simple as keeping a diary. If this is something that's hard to follow, just keeping notes or a diary that you can use, to record different experiences here. And make an appointment with your doctor and talk about what you're noticing here. So maybe writing down if you're noticing that you're limiting more of your normal activities, you're missing school or your work because of asthma. You're using your quick relief inhaler more than a couple days a week. Your asthma medications are not seeming like they're working well anymore. And or maybe your symptoms are occurring more often, they're more severe, or again, you're losing sleep because of this, you're waking up with symptoms of your asthma. So it's all about kind of creating this action plan so everyone knows how to control your asthma symptoms and asthma attacks here. And then finally, here's some additional resources that might be helpful to you here. The first one that I want to point out is the Ohio State Health Plan Care Coordination Program. So, this is a program where Ohio State faculty, staff, and family members can work with a care coordination nurse, pharmacist, and team of other healthcare professionals to better manage their chronic health conditions such as asthma. Um, it can help you improve your health, change some different kind of behaviors around that, understand your medications better, but also save you money too. It can cut down on some of the costs here with some reimbursement for some medications. So if you want to learn more about that program to see if you're eligible or someone um, in your family is eligible, you can call or use that link on the screen there. Or you can also find them through the Ohio State Health Plan webpage as well. And then there's just some additional great resources for more learning or understanding about asthma and ways to control that you might want to check out. Last but not least, another great resource to tap into is the individual health coaching program. It's available to all OSU benefit eligible faculty, staff, and their adult dependents. And we work with folks related to setting goals on weight management, stress management, nutrition, physical activity, or even tobacco cessation. So we're really here to support people in making healthy changes in their life, keep them accountable with goals, and support people as they're making changes to improve their health and wellness. So this is a great way to reach us if you're interested in learning more or setting up a health coaching appointment. All right. I want to thank you all today for joining me. I appreciate your time and wish you the best of health.